Good afternoon, everyone. This is Mayor Bowser calling. It's Monday, and we are gathered in the John A. Wilson building at City Hall. I'm joined by members of my budget team who are going to help me provide an overview of this year's budget process. I'm proud to say that we have conducted a call like this in each of my 4 years as mayor, and this will be the first of my second term. And we are also kicking off our budget engagement. And the first of those budget engagement events start with this senior town hall. So, there are additional opportunities to participate in person. The first in-person budget engagement forum will be February the 21st at the Arthur Capper Community Center. The second will be February the 23rd. Um, and the last one will be Monday, February the 25th. I'm joined as well at City Hall by your neighbors from the Bernice Fontenot Senior Wellness Center from Ward 1. And I notice we have also have seniors from all 8 wards who are participating via television, and we will look forward to hearing from them as well. Let me just say a couple of things about our budget and some of the things that we have been able to invest in over the previous 4 years to contribute to senior wellness. Among many investments in last year's budget, for example, we cut in half from 10% to 5% how much property taxes can go up for qualifying seniors each and every year. Let me repeat that because frequently when I'm in meetings, there are seniors who are not taking advantage of this benefit. We included and funded in our budget last year a cut from 10% to 5% of how much taxes can go up for qualifying seniors each year. Once again, we invested $100 million for the Housing Production Trust Fund and $10 million in the Housing Preservation Fund. We also increased our Safe at Home investment from $1.5 million to $4.5 million. And we'll talk a little bit more about that as we go along. We invested $5 million in our Transport DC program, which gives our seniors transportation options and more independence. And we also provided $7 million in water bill relief for DC residents and nonprofit organizations, including churches and religious organizations. We put $1 million towards a new senior wellness center in Ward. Let me just double check this figure. Is that 14? We put $11.4 million toward a new senior wellness center in Ward 8 and $3 million towards the renovation of existing wellness centers in FY 2019, including expansion of the Model City and Congress Heights centers. These investments are making sure that we continue to be an age-friendly city. I am now going to ask members of my team of my cabinet to introduce themselves, and then you will hear from the Deputy City Administrator, who's going to talk a little bit more about the budget process.
My name is Sasha Carlisle. I am the Deputy Budget Director in the Office of the Mayor. Welcome to all of you.
Tomas Talmonte, Deputy Chief of Staff to the Mayor.
Hi, good afternoon. Delano Hunter, Acting Director of the DC Department of Parks and Recreation.
Hi, Laura Newland, Director of the DC Office on Aging.
And my name is Kevin Donahue. I'm the Deputy City Administrator, and I'm also going to give a few opening remarks to set some context around our budget. So, first of all, thank you, whether you're here in person or listening in, for being here on a winter day. Like the weather, we have seasons in government that we really organize ourselves around. And right now we're in what is the peak of budget season. So we're in the FY19 budget. We are planning for the FY20 budget. That starts on October 1st of this year and will go for 12 months. And the budget is one of the most important things that we plan for and do each year because it's more than a document. It is our plan to move DC forward, and this can only happen with your support and your feedback. The district has for 22 years submitted balanced budgets to council, and this year will be no different than that. And opportunities like today help you provide us with valuable insight around and guidance around what our priorities should be as we make tough choices around recognizing where there are needs and recognizing that there are scarce resources to which we have to apply and resolve those needs. The Office of the City Administrator helps prepare the budget, and we do it through feedback that we get from the mayor, feedback we get from the public, and also by looking at what each agency needs to be able to continue to operate responsibly. Now, I want to give you some context around the numbers of our budget. So our economy is doing very well for the past few years. So we have a local budget of $7.9 billion. I say the word local budget because that means above that 7.9, we also have federal grants that we get, and we issue debt for construction. But that budget that we fund programs with, personnel with, is $7.9 billion. That's divided a few ways, and I'm going to group sort of activities and policy clusters. Education gets $2.3 billion of that $7.9 billion. Public safety gets $1.2 billion. What we call jobs, housing, and economic opportunity is $336 million. Health and Human Services gets $2 billion. And transportation, government operations, our pension funds go for $2 billion. Now that's some very big groupings, and over the course of this phone call, we can help tease out and go into detail where you sort of give us direction. So where we are in developing that is we've spent the past couple of months looking at agencies and having agencies work with their CFO to tell us what they would need to continue carrying out their work for one more year. So they look at inflation, they look at changes that they're required to make under the law, and that gives us what we call our baseline budget. Then the CFO tells us how much revenue we have that he thinks we will have next year. And when there's a gap there, when we have more projected expenditures than revenue, we have to make tough choices. And that's where feedback like this is going to be very helpful. So over the next month, we're going to give the mayor some tough choices to make. And on March 20th, we will submit our budget, the mayor's budget, to the DC Council. They will then, over the following 2 months, have council hearings, and they will finalize their budget typically in May. Then on October 1st, our budget becomes a real document that we use to deliver service to you, the DC residents. Now we can roll up our sleeves and with that context, get to work.
Thank you, Kevin. That's helpful. Seisha, do you have more comments to add?
No, I just want to say welcome to everyone. It's incredibly important part of our process to hear from all of you. And I know the mayor takes it very seriously. I can speak for that from experience that we have been able to invest in things because of the feedback we've received from all of you through our budget engagement process. So thank you again for coming. It's very appreciated. It's appreciated by my team because it's helpful to hear the ideas coming directly from the residents of the city. And I know it's helpful to the mayor. So just thanks again.
Okay. Well, thank you, and I appreciate that as well. At the outset, you heard introduce the director of the DC Department of Aging and Community Living. We were pleased to be in Congress Heights last week, where I signed into law a new name designation for the DC Office on Aging, as well as Delano Hunter, who is new at the Department of Parks and Recreation. Both agencies have a responsibility for providing wellness, recreation, and nutrition services for our seniors, and they are both here also to answer your questions. So what I thought I would do before going, I'm looking at a screen, although I'm not exactly sure where each of you are. So I see a Ward 1 site. Is that the Fontenelle Center? Ward 1 can somebody respond?
Ward 1, go ahead and unmute your phone and respond.
How are they going to ask questions? Okay, I'll start here, and then we're also able to take questions from the phone line.
Yes, and if you're on the phone and would like to ask a question for Mayor Bowser, we have over 300 seniors joining us on the phone. Please press 0 and you'll be added to the queue, but we'll start with some questions in the room. Again, if you're on the phone, please press 0 now to highlight a budget priority with the mayor.
And I should have also noted that if you're at home watching and you're
Yes, we are here.
Ward 1, go ahead and unmute your phone and respond.
Hi, Ward 1.
Hello, we are here.
Okay, who's speaking?
Hi,
Hi, there you are. Fantastic.
I'll start here.
All right. That's a little bit of a lag.
Okay, I got it. Well, that's more than a bit of a lag. All right, Ward 3. Can you hear me? And what's your location? They're having a good lunch. As I was saying, I should have noted that if you're at home and watch and listening on the phone, you can also turn on cable channel 16, which is our channel on cable.
So we can start with some questions around the room, and then we'll go to some questions on the phone.
Okay. Any questions about, yes, Mr. Moore?
Yes, Madam Mayor. First of all, thank you for engaging us in this budget overview.
I think we're about
I don't have a question right now. I'll
Okay.
come back to a question later, but I do have a comment. I'd like to thank you for signing, and I'm going to read this. My vision is very poor, so I have to read it. Thank you for establishing the Senior Dental Service Program. And I have a question within this, but again, I'd like to thank you for establishing that particular program, because dental service is indeed very important to everyone, especially seniors, because many of us are in a situation where we can't afford to pay the amount of the cost of dental care. So I'd like to thank you for that. But the question behind that is, will there be a follow-up to this? I noticed that there will be grants. Does that mean every year you will have to open the possibility of providing grants for that particular activity?
Yes, and thank you for that. And maybe somebody can get me the details. But I know that was actually a piece of legislation authored by Councilmember Todd. And does anybody know the details of the legislation and if we were able to fund it last year?
It is currently funded
Okay.
through DC Health.
Through DC Health. Okay. And so we will, it sounds like a program that we will need to continue to watch every year to make sure it has the types of funds that it needs and to watch its usage. I would anticipate that it's a type of program that grows and grows. So we will have to see how people apply and how much we need to invest in it every year. Ms. Matthews.
Good morning and thank you. I would like to ask you about the dealing with the water pipes, lead water pipes.
Okay.
I understand that legislation was passed, and going forth in October of this year, the residents in the District of Columbia will be able to get their lead pipes removed on their property based on income. going forward with that, when will the applications be available?
Okay.
Because I've printed off as much information as I can,
Okay.
and I know nothing will take place until October.
Right.
So,
Well, one thing that we have done, Miss Matthews, and I have to give my team a lot of credit because frequently our budgets go into effect on October 1, and sometimes in the past, that's when all the planning began to spend it. My charge to my team is if funds become available October 1, I want the programs ready to go on October 1 as well. And we know it's coming. We know it's an application involved. We know we have to figure out the eligibility and do some public education. And I am thinking that this is something that DC Water will continue to implement. So thank you for raising it because I'm going to make it rise to the attention of my board members on the DC Water Board, which is led right now by Tommy Wells, who is also the director of Energy and the Environment, and he chairs the DC Water Board. So I'm going to let them know. In fact, I'm going to put it on my cabinet meeting agenda that for October 1, just like we were able to do last year, we want these programs to go live. Another big example, and this may affect both the directors who are here, is that we sometimes add new staff. And those FTEs, those employees' time becomes available on October the 1st. What we were able to do last year is have the position descriptions ready and for them to go live on October 1st so we could do all of the hiring soon after the new budget is available.
I want to thank you for that because some of the citizens that are still remaining in the city going forward, if it wasn't for Safe at Home and programs such as what you're legislating, they couldn't stay here.
Yes,
It's
ma'am.
imperative. And just like with the real property tax, although it was reduced, the assessments was reduced by the 5%, not the assessment, but the property taxes rates for seniors was reduced 5%.
Yeah.
The problem is that some areas the assessments is not helping the seniors because I'm getting feedback from seniors saying that they're paying $3,000, $4,000, depending upon where they live in the city. Although it's a good program, going forward, I think some of the people are going to need you to look at that again.
Do you have a recommendation, Ms. Matthews?
Yes, I do.
Okay, I would love to hear it.
I think it should be tiered.
Okay.
I think it should be tiered for seniors. For the people that are coming in, new homeowners, yes, I can understand that with the development in the city. But for seniors, they should not be subjected to the same guidelines, even though we do get a discount, even though we do get a break. If it was tiered, I believe that it wouldn't be a choice for the seniors to be able to either pay your taxes or get your medication.
Right.
It's a burden.
So let me, when I was the Ward 4 council member, I moved a piece of legislation that increased the eligibility from households of $100,000 to households of $125,000 as the upper limit. The second piece, as I just talked about, was I further reduced the cap. So if you are a senior and your household income is, and I'm doing some of this because some people are hearing it for the first time. If your household income is $125,000 and below, you pay half your tax bill.
Mm-hmm.
You just referred to that.
Mm-hmm.
And the additional piece that we moved, it would still be subject to the 10% increase. If your assessed value went up 10%, right, it would still be capped at 10%, but you would pay half of the tax bill. Okay. What we did last year was say your assessment cap is no longer 10%, it's 5%. So your assessment is capped at, the tax bill is capped at 5% increase year to year if you're $125,000 and below, and you pay half. Okay, so that's the status quo. I understand that Councilmember Todd, and this is for my team to hear me and hear me well. has a bill, and we're hoping that the council moves it out of the finance committee before budget season, that would increase the homestead deduction.
Yes.
And that helps seniors, but it helps everybody.
Yes.
Because everybody is feeling pinches of 10% increases. So that's one thing that I have on my agenda to look at going into this budget season. If we can raise the homestead deduction, how much could that save you on the other end of your tax bill? The other thing that I think we have to consider, and there is some controversy about this among the council members because some of them don't like it, and that is to make a 5% cap for everybody as well. So from year to year, instead of being able to go up 10% a year, we would cap it at 5% a year. So there are a lot of arguments, and that's not a inexpensive option, because what it means, just like all of these things mean, is if I cap it, that means there's less revenue coming in,
Yes.
which means there's less programs we can spend on.
Okay, and I like the idea about the homestead.
Okay.
I like that part.
Okay.
Yeah, if we can't do it tiered, the homestead would really benefit some seniors, because you have seniors that are making some 20,000, 25,000.
Yes, ma'am.
30,000, and the department, the Treasury Department, really needs to look at the poverty level for seniors.
Yes, ma'am.
Because it has not changed in years, and if they did that, I think employment will be better for the seniors. What they can and cannot make, but something needs to be done because they need the additional monies.
I got it.
Okay, thank you.
Thank you. I appreciate that. Mr. Moore, do you have another question?
I do, Madam Mayor. So, Madam Mayor, now that the DC Office on Aging is now the DC Department of Aging, does that mean their budget will be increased?
Well, the answer is it may be increased, but not for that reason. What Director Newland is always charged with is making sure that we're supporting seniors in the way that we need. Just like before I was mayor, there was no Safe at Home program. And now we have, and I was so happy to hear Ms. Matthews say that it's making a real impact on people's ability to live in their homes. So what I would say to Laura is, are we at the right level at Safe at Home? Are we implementing it fast enough? Do enough people know about it? Is it the right scope? So that's important. Another thing that we have also, and I'll ask Director Newland to talk about this a little bit more, is we continue to be concerned about seniors who are disconnected from the Office of Aging, from church, from family, from you name it, and we don't know what their needs are. And sadly, the experience with the Arthur Capper fire really put this situation, it spotlighted it for us, because here we have a senior facility. Many seniors have been supported through the housing authority at that facility. And yet, when we went in there through the tragic events of a fire, we found seniors who were mismatched with the appropriate level of services. They were living at home in a senior building and not being properly served. So imagine the seniors who aren't living in a multi-unit facility like that for seniors who may need our help. So senior isolation is something that we are very concerned about, and we're going to spend a lot of time this term trying to break that situation. Laura, do you want to add anything about caregiving as another area of concern?
Sure. We know that it's not just seniors who experience social isolation and negative impacts of that, but also caregivers. And we have a lot of caregivers in DC, and some of you here, and I know in the centers, because we've talked about it, are caregivers and on the phone. And so I think one of the things that we need to do is to figure out how can we support the unpaid caregivers better, to make sure that you're not socially isolated yourself, and because we know caregiver burnout leads to a lot of negative health effects, not just for the caregiver, but for the person who's receiving the care, because it's the unpaid caregiver who often allows people to live at home. So, we'll be talking with the community and also working across government. I know Director Hunter is here. We've been talking about how to embed caregiving services within DPR sites. And so we're really looking forward to moving together on that in your second term.
Thank you.
Mayor, we do have a question from our Hayes Wellness Center in Ward 6. Ms. Frankie Whitfield was wondering what your plans are for more investments in alley repavement and infrastructure.
Ms. Hayes?
Yes.
Ms. Hayes, that's one of my favorite topics. So I won't bore you with a story that I frequently tell. Well, maybe I will, about how when I was first elected in 2007, I asked the DDOT director then, I'm the Ward for council member, people were complaining to me about alleys, and lo and behold, my own alley was a wreck. And I said to him, how long is it going to take us to deal with these alleys? And he looked at me and he said, well, council member, at this rate, with these investments, with these number of people, it will take...
Please mute your phones.
It's just coming back to me. So the response was, at this rate, it will take 40 years. And then I dug into the budgets and I said, yes, you're right. It will take 40 years. So I made a deal with myself then that if I ever became mayor and I could do anything about it, we would change it. And so we started Alley Palooza in my first year. We did it for 4 years, 2 alley paloozas every year. We were able to do 500 alleys. We did it equitably. We did 8 alley paloozas in 8 weeks in all 8 wards. That is what Alley Palooza is. 64 alleys in 8 weeks across all 8 wards. And that has enabled DDOT to be able to plan effectively and deliver on those alleys. And so we will continue that level of alley investment. In the last budget cycle and moving forward, we have worked hard with the council to stop touching our roads budget. Because my experience since being a council and mayor is that we trim a little bit off the budget for roads here and there, $1 million here, $1 million there. And over the years, that compounds to the place where we have 30% of our local roads in poor condition. So we have modeled a new paving program called Pave DC off of Alley Palooza, where we're going in and identifying the 30% of the poorly rated local roads and knocking them out. And if we are able to maintain our current budget, we will eliminate all of those by the year 2024. And I know that sounds like a lot, but you will be a long time rather. But you will be able to see immediate improvement. Because one thing I know is that DC residents go across the city, go across all 8 wards. And so it's important not just that we are doing one neighborhood here and one neighborhood there, but we're making improvements across the city. And you'll be able to see the impact on all of your trips, the doctor, to church, to see your friends. You'll be able to see new roads across all of those trips.
We have another question from Ward 3, Miss Elizabeth Berry. She wants to know what you're planning on doing to expand the budget to help Washington, D.C. become a zero-waste city.
Well, that's a good question. So many of the things that will get us to just better use of energy, and I'll talk about zero waste in particular, and the deputy city administrator may have more to add. But we have worked very closely with your council member, with Council Member Che, on DPW issues that will help us get to zero waste. You may have noticed that we have had composting facilities at farmers markets across the city. Our goal is to be able to have curbside pickup of food waste. And that is going to be very helpful to us getting to zero waste. We're also working with our food providers, including restaurants, about how we can get to zero waste. And we're always, and I think we can do more, where we can really do more is working with each one of you and residents across the district about how we can reduce, reuse, and recycle. And our investment, and this is where I see the most bang for our buck, is investing in our young people at schools and teaching them about composting and getting to zero waste. And you may be pleasantly surprised by how much the kids know and how well they're doing at schools across the district.
Great. And we have another question from Ward 1, Mr. Richard Smith. He said, as seniors, we want to make sure there are new developments in education. And so he's wondering what additional investments you'll be making in the new budget.
Well, thank you for that question. And there is not a discussion among seniors that I have where schools and DCPS isn't tops on the list. And many seniors are DCPS graduates. We have any DCPS graduates in the Wilson building? Not one. Oh, wow. You, Mr. Moore? Where did you go to school, Mr. Moore? My mother went to Cardozo. Were you in school with my mother? Maybe. How about that? Well, my mother is 80 years old. Well, I don't know exactly, but she's 80. So she was born in 1938, 1958, but maybe 1956, I would guess. Okay, so she's a clerk. Okay. Yes, ma'am. Cardozo too. Well, we're in the Cardozo neighborhood, huh? At Fontenot. Okay, very good. So I digressed, but my point was that people across the district, no matter where they have kids in DCPS or DCPS graduates, have grandkids or no kids, people recognize that having a well-functioning public education system is vital to the health of the city. I think you all know that I appointed Louis Farabee to be the next chancellor of DCPS. He actually had one of his confirmation hearings, I think it was at Cardozo, and the final one is tomorrow, and I expect the council to approve his confirmation in early March. And he is the right leader for DCPS. He comes to the system with years as being a teacher, a supervisor, and a superintendent, and experience in the areas where I think we really need a focus. And that's middle and high schools, attracting and retaining high quality teachers and giving them career advancement opportunities in the system, and making sure that kids are prepared for career and college. And quite frankly, I think that we have not fully engaged the non-college part. And how do we have a fresh look and a refresh of how we deal with career education in our public schools? That's part of our focus. We also have, of course, public charter schools across the city that are also evolving and maturing. We have about half of our public school students are in public charter schools. And I'd like to emphasize that public charter schools are public schools. We all fund them with our tax dollars, just like we do DCPS. We have seen, I think, 9 straight, or maybe 10 years now, 10 straight years of growth in public education. So this public school population continues to grow. We see improvements in in how our kids are testing in reading and math. And in the last year and a half, we also got a real true look at our graduation numbers. And we had to refocus because we were finding that we were not properly attributing attendance to a student's graduation ability, which we require. You have to go to school and able to graduate from school. And so in the last year and a half, we have fixed those systems so that we can be assured that the children who are graduating have proper attendance and mastery of their coursework. And in doing that, we feel very confident that I think we ended up at like 65% graduation rate, which is up from low 50s when we started our education reform movement in 2007. And we think in the next couple of years we will be able to hit a target which will represent a real improvement in public education in the district. So that's where our focus is. And we're also focused on how we close the achievement gap, you'll hear everybody say. And what that means is how do we make sure that our Black students are doing just as well as their white counterparts. And what we've seen in education and our experience with education reform is all the kids are doing better. And in some cases, the white kids are doing even better than we were when we started in 2007. So I want to be able to say that for every population in our city. And that includes children who learn differently. That includes our Latino students. That includes the difference between girls and boys. So there are a lot of things that we have to focus on and moving our schools forward. You will be happy to know, because your question was a budget question, I don't think that DCPS has a budget issue at all. We invest, and because of you, that you allow us to, a significant amount of money in public education in the district. And we are all called on to make sure we're getting our money's worth and that we can talk about the outcomes that are improved.
Juanita?
Mayor Bowser.
Yes.
Mayor Bowser, it's an honor to be with you today.
Thank you.
And I want to thank you. I've been before you so many times. So I have like a couple of questions.
Okay.
I want to thank you for the Bernice Fontenot Senior Wellness Center. And wellness means a lot to me. I just turned 70 years old week before last.
Mm-hmm.
And I credit it to the valuable programs that you have at the Bernice Fontenot Senior Wellness Center, and you're doing a great job. And I just hope it continues. I know when you first started talking to us, it went from, your paper says 14.4 million, but you actually said 11.4. Is it going down?
No,
can it be increased? I just think it's so very important for us
this
seniors.
is for Ward 8, and I actually just misread it because I don't know why. That's why you saw my assistant come down with my glasses. But I'll have to double check because I have just a corrected sheet here, and I misread it.
Okay. I can actually
Okay.
clarify.
Okay.
The amount definitely did not go down. So there's 11.4 million for new wellness center in Ward 8. And then there was $4 million for renovations and accessibility upgrades that needed to happen across all of our wellness centers.
Okay.
And that is also including Bernice Fontenot.
I got it. So,
Hallelujah.
And then
Great.
1.5
Very
for the
astute.
expansion.
Yes, Laura is exactly right. So the 11.4 is for the senior wellness, and the 3 gives us 14.
Wonderful. Thank you.
Thank you.
And I want to thank you for all that you're doing for the Housing Production Trust Fund.
Thank you.
You mentioned it, and and housing is just so very, very important. I just stay in front of you. I stood in front of your face so many times when you were our Ward 4 representative.
Mhm.
And last year and again this year, I'll be before DC City Council advocating for affordable housing. But I want to thank you because my building, we did receive finally $8.4 million.
Good for
We
you.
were sold, and so we remain affordable. And I want to thank you and just ask that you continue to fund the Housing Production Trust Fund.
Absolutely. And I think we can make a case for doing more with housing. And I shared in my inaugural remarks how much more I think we need to do. And I'm not talking just about the Housing Production Trust Fund. I am talking about all 8 wards, across all 8 wards, developing a set of goals for creating more affordable housing. One thing that I learned is that we talk about adding more affordable housing, but sometimes when it comes down to individual products, our actions as communities and neighborhoods don't match our concern about affordable housing. And what do I mean by that? We have right now, and I think 2,000 units. Somebody will correct me if I'm wrong about that number, but it's many hundreds of units that are held up in court because there's this group of people who are suing us or development projects anytime that we advance a planned unit development. And what planned unit developments allow is for more housing to be built and oftentimes more affordable housing units to be built. And so we as a city have to confront this kind of mismatch that I see. A concern, I mean, a number one concern among DC residents of all incomes is affordability, especially affordable housing. Yet, we can have housing projects stopped that have affordable housing. So we have to deal as a city with that mismatch. And our focus on closing DC General taught me a lesson. And I knew going in that we wouldn't be able to build short-term family housing. It wouldn't be fair if we only built it in one place. And the issue of homelessness is not a Ward 2 issue only, or a Ward 8 issue only, or a Ward 4 issue only. It's the all 8 wards problem. So it needs an all 8 ward solution. And that's why we identified and built short-term family housing in all wards of the city. The same is true, I think, for affordability. If we know we need 36,000 new units by 2025, let's look across the city and develop a goal for each ward or neighborhood, a single. I don't know exactly how we're going to do it, but we're going to say we all have to be a part of the solution, and that is how we're going to move forward. So, and I invite your advocacy on the Housing Production Trust Fund, Ms. Hayes. But I may submit to you that that's easy. What's going to be hard is your advocacy for all 8 ward strategy for affordable housing units.
We are working on that.
Will you be with us?
I want to be with you.
Thank you.
Yes,
Okay.
I will. Because in advocating for affordable housing, I work with now 6 groups.
Good.
And it's only me one, and I wish I could clone myself, but I am with, LEDC, CHNED, Empower DC,
Yes.
One DC, and I'm not 45 anymore, but I know the need is there. So,
All right.
like this weekend, Northeast, Southeast, I was there, but I'm with you.
All right. So,
All the way.
but I like that you have that connection with all of those groups, because I think all of the groups that you just mentioned want people to be able to afford to live here. We just don't always agree on how to get there. Yeah. So let's have that robust conversation. But the experience has shown me is that we need a whole city solution.
Yes.
Okay. Yes.
I'm going to let you slide this time. This is for Mr. Hunter.
Okay.
Ever since I met you at the Masonic Temple, the little luncheon there.
Yes.
You gave me a number. I've sent you emails. I've tried to contact you by phone. We have a serious problem at Parkview Rec Center, and I talked to you a little bit about that then. I don't know what the disconnect is. I don't know why you haven't gotten back with me, but I'm a little miffed with you because they're still doing drugs up there. There's still issues up there, and it's still a hub for illegal activity, but it's not as bad as it once was. I want a solution for that center. You have a couple of employees there that are very good at their job, but then again, you have employees that aren't doing their job. So you need to connect with me.
Sure.
We'll take care of that, Ms. Matthews.
If I can respond, thank you for your engagement. During the month of January, I had an opportunity to visit all 63 of our recreation centers, including Parkview. We did invite the local ANC, and I believe you as well. I gave a list of our members to actually call. I can certainly double check on that. During that time, I had an opportunity to talk to our tailoring program, also the staff there. I met with our park rangers and also our roving leaders about the program that's there that is designed to engage those residents. I'd be more than happy to have an individual meeting with you, but I do know from speaking with my staff, we invited all of the stakeholders there. We also met with Councilmember Nadeau, who mentioned some of the issues that we have there as well. So I certainly apologize if that message did not reach you, and certainly we look forward to having something separate with you. But I know that call was made.
So we're talking about inside the center or outside the center?
It's inside the center. We have Mr. Earl Davis. He's a roving leader, and he's really connected with the young people there. He also lost a son of his to violence, and we had a celebration in January in which we do a potluck, and the young people that were there, they were courteous and so forth and so on. But my problem was, and I talked to Mr. Davis about it, was the drugs that you could smell on their clothing.
I got it.
Okay. They didn't disrupt. A lot of them hadn't even had chili before.
Okay.
And he tries to have food for the guys in the evening. I talked to them. I talked to them about grid alternatives that they're getting ready to start another class in March.
Yep.
And I told them that they need to stop blaming everybody else for something they need to be doing for themselves. But I also talked to the roving leader, Mr. Davis, about the fact that they should not be coming into the center smelling like that because they're around other young kids. Like I said, they wasn't disrespectful, but I know what they do. I've seen them smoke drugs on the playground. I've seen them gamble on the playground. I've seen them drink. And these are the things that should not be continuously going on.
Okay.
Okay?
I got it.
We're going to go to the phone line for Ms. Barbara Herbst in Ward 3 has a question related to nutrition programs. Barbara, can you hear us?
Yes.
Go ahead.
Yes, thank you for taking this call. I believe that malnutrition in the elderly is often underdiagnosed, and I share the mayor's concern for seniors who are disconnected or senior isolation, and I was wondering if there's any allowance in the budget for nutritional assessment of seniors, particularly those that choose to age in place and may be overlooked.
Sure. Laura, do you want to talk about how we, what we're doing now in senior nutrition?
Yes. So that's a really great question because it's not just about feeding people, it's also about making sure they are getting the right types of food. We have in every ward lead agencies, and they're required to have nutritionists on staff. And their primary responsibility is to do nutritional assessments for homebound seniors and seniors who participate in our community dining sites. We have been in discussions with them about maybe looking at the efficacy of that program and whether or not we need to look at different ways of doing things to be more effective in the city. But we definitely agree with you that this is an issue that needs to be addressed and perhaps more fully than what we're doing now.
Okay. Thank you for that question.
Great. We have another question from Ms. Janet Sharp in Ward 2. Janet, you're on.
Yes. My name is Janet Sharp. I am with the Restroom Initiative. Why can't we, is it possible, why can't we have some restrooms here in the district? I mean, for seniors, for tourists, for everybody. Other capital cities have them. We have brand new Dope sponsored a bill. Why can't this district have them?
I believe the council just moved a bill through to have us investigate and see how we can make public restrooms available. There are obviously upsides and there are obviously downsides. And what we will look to investigate is how we can manage the downsides. I will say, as part of the Age Friendly Task Force, we have asked our business community to be age friendly businesses. And part of being an age friendly business would be to make restroom facilities available to the public. And we know immediately the government can do a lot of things. We can do so much more and faster in partnership. And that's one way that we can manage the availability of restrooms without a huge investment of capital in construction or operating, but in partnership with our local businesses, and that's what we will continue to do. So I think that we are getting close to the end of our time together. As always, you've given me some very good things to think about, including watching the use of our dental service program. And also, we had a very robust discussion about property taxes, the homestead exemption, and tiered property taxes for seniors. A good discussion on lead pipes, nutrition, public safety issues, including around our recreation centers, which is very important to us. So we will continue this conversation. I think this Wednesday, I will have a similar call like this that goes out to DC government employees, which this will also be our 5th year with that conversation over lunch, where employees can call in and ask questions as well. We will wrap up with our budget engagement forums. And at the end of March, is that when I submit? Yep. At the end of March, we will be submitting our budget proposal to the council. The council will then begin its work and have a series of meetings and approve a budget, I think at the end of June, early July. And as Ms. Matthews already noted, that new budget, the FY 2020 budget, will start on October the 1st. So I want to thank you for your participation. I will see you out in the city, in the wellness centers, and everywhere else. And have a great and safe day.
Thank you. And we did want to say for everybody on the line, if you would like to submit any of your budget ideas and weren't able to do so on the phone, you can call 202-442-8150. Again, that's 202-442-8150. Or you can email your fresh budget idea or budget priority to engagement.dc@dc.gov. And if you're watching from one of our Senior Wellness Center's live watch parties, please make sure to share your budget priorities with our MOKers who are there with you at each of the watch parties. So thank you so much.
Thank you.
I just want to thank you for inviting me to sponsor us in the Wellness Center.
Oh, it's my pleasure. It always is. It's good to see you all. Thank you. Thank you.